Have you ever felt down in the dumps and discovered that you have less energy than you usually do? Or maybe you get sick after you've been feeling particularly stressed. Many studies have shown that psychological factors can affect physical conditions. There are two main ways that psychological factors can influence physical conditions: direct and indirect. Direct factors lead to a physical complication just because you have the psychological issue. For example, depression is a direct factor on insomnia. Just having depression can lead to insomnia. Compare that to indirect factors, which lead to physical complications because of the way the psychological issue impacts your behaviors. For example, anxiety can be an indirect factor for lung cancer, since people who feel anxious often smoke to relieve their anxiety, and smoking can lead to lung cancer. Studies have shown that a higher proportion of people with anxiety have lung cancer than the general population. However, that doesn't mean that the studies have found that anxiety is a direct cause of lung cancer, only that the two go together in some way. When two things go together but are not cause and effect, it is called a correlation. Let's look at two common physical ailments and how they can be affected by psychological issues. One common physical ailment that can be affected by psychological issues is hypertension. Hypertension is the medical term for chronically high blood pressure. There are many other medical conditions that hypertension can increase the risk of, including heart disease, aneurysm, and kidney disease. It can even lead to premature death. There are many causes of hypertension, including salt intake, genetics, and environmental factors. However, in addition to these, there are several psychological conditions that can directly or indirectly affect hypertension. Anger issues are correlated with hypertension. These can range from defensiveness and suppressed anger to personality disorders. Studies have shown that having anger issues increases your risk of hypertension, though again, they cannot say that anger is a direct cause of hypertension. Another issue that is correlated with, though not necessarily a cause of, hypertension is anxiety. Whether anxiety is a phobia, another anxiety disorder, or just a bad case of stress, having chronic anxiety increases your chance that you'll also have hypertension. Finally, depression is an indirect factor that can influence hypertension. People who are depressed tend to make lifestyle choices that can increase the risk of hypertension, such as eating junk food and not exercising. As a result, many people with depression also have hypertension. It's important to note that the psychological factors that affect hypertension need to be chronic. That is, they need to be present for a long period of time. Feeling angry for a few minutes one day isn't going to raise your risk for hypertension, though it might temporarily raise your blood pressure. However, dealing with an anger issue that is ongoing over a long period of time is correlated with a higher risk for hypertension. Like hypertension, asthma, a chronic disease involving difficulty breathing, can be exacerbated by psychological factors. Depression is an indirect factor that can make asthma symptoms worse. As we saw with hypertension, people with depression may engage in unhealthy behaviors that can make physical ailments worse. In the case of asthma, someone with depression may smoke, or may be less likely to seek medical help or stick to medical treatment for asthma. Anyone who has ever felt anxiety can probably understand how it can make asthma symptoms worse. When people feel anxious, they often take shallow breaths or hyperventilate. Since asthmatics already find it difficult to breathe, anxiety and stress can exacerbate the problem. Psychological issues can cause or exacerbate existing physical diseases in both direct and indirect ways. Anger, anxiety, and depression have all been linked to hypertension, or chronically high blood pressure. Anxiety and depression can also make asthma symptoms worse.